Board of meetings. So welcome everyone. I hope that you all have been doing really well. Happy New Year for folks that I haven't gotten to see yet so far this year. And I hope that everything is aligning really well for you and things that you hope to have done this year are coming together. So let's just go right into our agenda for today. So we're going to start off by having a couple of our BBOs share the work that they're doing with their councils at this moment. And then we'll break out into some small discussion groups to allow folks to maybe ask more detailed questions or just to kind of facilitate some community sharing amongst you all. Some of our team will be in each of those groups to just kind of help facilitate conversation if you all need some enthusiasm and some additional discussion questions. And then we'll talk a bit about two upcoming evaluation activities that we have for you all. So success stories as well as eco maps. And then we'll be closing out with any grant updates and of course, leaving some time for questions that you all have for us kind of going forward. So that should take us to 3 o'clock or pretty close to that. So I am excited for our time together. So to start with our council spotlights, we were able to get 3 of our backbones to be willing to share today. Macomb, the Judson Center, and Genesee County with the Greater Flint Health Coalition, and Oakland with the Oakland Health Division. So this is not necessarily the order. So if someone is really excited to go first or would like to, feel free to volunteer. And if you have slides, you can feel free to share your screen or anything.
I'm happy to go first so
it.
that I can eat my food because that's what I'm most excited about. So I'm happy to share an update about our Genesee Health Equity Council
Awesome.
with the group. And I do have some slides, should be ready to go.
Okay, I'll stop sharing and allow you to share.
All righty. Okay, so I just wanted to kind of highlight some of the things that we've been working on. And I think what's really the most exciting about all the efforts of the councils is there's so much diversity in terms of projects and areas of opportunity. And so our council in particular, we had hosted a visioning session in July, and we spent a lot of time trying to work to identify our priorities. And what we come up with really was focusing on equitable funding and capacity building opportunities for our grassroots organizations. And so we've done that a couple different ways. One, we've worked with some partners and we developed some grant writing workshops. We've also developed a special cohort that I'll explain a little bit later. And then also having our mini grant funding opportunities. In addition to those capacity building focuses, we've also really supported relationship building with our local funders. So within Flint and Genesee County, we have 4 primary philanthropic organizations, and we've been working closely with them to help our smaller grassroots organizations start to build relationships of their own with those funders. So when we look at some of the different components we did, our grant writing workshops, these were pretty comprehensive opportunities that we had available leading up to our RFP release for our mini grants. We did mini grants last year, and we saw that there was definitely some areas of opportunity across the board. And so we actually had a couple different classes available. So we had a grant writing basics class, a data collection and management class. We did a sustainability and collaboration class, evaluation management, and then also budget management. And we offered these multiple times. We did sessions in person and then also via Zoom. And so that was something that we're really excited about. Our council actually helped to develop all the components for these classes. And then we worked with a partner in terms of actually executing these workshops throughout the community. Additionally, we worked this year, this was new for us. So we developed a cohort, and what we did and what this cohort was is it really was a group of grassroots organizations that we identified that had submitted a mini grant application last year, but they were on the lower scoring end. And so what we did is we actually invited 12 of those organizations to invite them to participate in this cohort. And the intention was to really help support skills development and capacity building within those smaller grassroots organization. And so some of the requirements of the program is, number one, they had to meet with us and we were able to give them feedback from their first application, right? So what did we see that worked? Where are the areas for opportunity? We also had them participate in a minimum of 4 grant workshop series. So budget, 101, data management, whichever ones they preferred. We had them draft a full application in response to the RFP that we produced. And we also had some technical support that was offered before their application was submitted. So we wanted to do a quick once over, and we worked really closely with a community partner to help support this component, to be able to look at their application to just see, you're missing this, maybe there's some areas for opportunity here. And then we also had them submit the grant application and then finally do an additional review session after that. And through this entire process, those cohort organizations could actually receive up to $2,000 for completing all of those components. And we were pleasantly surprised at the outcomes of the cohort group as a whole. So just some survey feedback that we collected. I felt supported throughout the cohort process. So we had 60% strongly agree, 40% agree. I would recommend this process to other grassroots organizations. We had 70% strongly agree, 30% agree. The information presented was useful. Again, 70% strongly agree, 30% agree. And then also GREC facilitators were knowledgeable and offered proper guidance, so 70%, 30%. So all across the board, we had excellent feedback from our cohort participants. And then just a couple quotes that we had collected as part of this. So one, the TA sessions were great and provides excellent feedback. Overall, it was a wonderful experience. Continuation of support is very much accepted and needed. And I really like this one. So it said, although I did not win the grant I submitted, this opportunity gave me the confidence and knowledge to know how I can apply for grants in the future. So we were really pleased to see that individuals were kind of taking the tools that they were learning throughout this process and ideally utilizing it for grants in the future. And additionally, one of our cohort members, this was really cool, is kind of through the interactions and collaborations, she inadvertently became a school board member just because having conversations with these different grassroots organizations, she learned of an opportunity to join the school board, and then she ran and she actually became a school board member just based on these cohort interactions. So we were really pleased with how this turned out. And we were really fortunate because many of the participants actually expressed interest in kind of acting as a mentor organization for future cohorts. So this is something that we really like the structure of, and we're hoping to kind of continue in some way, shape, or form in our community. And then leading up to this, obviously our mini grant opportunities. So we actually, having had that first year of experience last year with our funding, we had a little bit more organization and we're a bit more prepared this year. So we actually released our RFP in August and we had an early October due date. And then what we did is we were able to utilize our GREC council to review and score all of the applications. And then we also had an independent review committee. And so how we divided the applications is any organization that sits on our existing Health Equity Council, those applications were reviewed by our independent review committee, and then our actual council kind of reviewed everything else. And that was the best way to make sure it was kind of a non-bias as possible in terms of scoring. And then we were able to obviously rank and score the applications from there. In total, we were able to identify 23 mini grants that were awarded to the community, and we're very excited about those because we have a very wide range of age groups, populations, disabilities that we're working with through these projects. And I did want to note that 8 out of 12 of our cohort organizations actually received mini grant funding. So we actually took a group of 8 organizations that previously were not funded, and we were able to get them to the point where they were able to score high enough to be funded for a mini grant, which was really exciting component of our cohort process. And then funder relationship building. So we really want to support our council members as well as our other grassroots organizations. And so we've been reaching out primarily to our 3 local, our top funders, and we're having them attend future Health Equity Council meetings over the next couple months. And so they're prepared to kind of join us at our meetings, highlight their funder strategies and priorities, but then this also provides an opportunity for council members and grassroots organizations to kind of network themselves, right? And make sure that the funders are aware of them and aware of their resources. And one of the things that we're working on to kind of thank the funders for their time is kind of like a guidebook that funders can utilize. So say you're looking for a grassroots organization that works specifically with youth around nutrition, you know, what organizations already exist in your community. So we're really hoping to utilize this as a tool that our funders can then look to. And then obviously we want to make sure that our grassroots organizations have the ability to have that relationship with funders locally as well. And I think that's it. And so I wanted to keep it short, and I'm happy to answer any questions anyone may have.
Thanks so much, Nicole. It was a wonderful presentation. If anyone has kind of burning questions they want to ask now, feel free to either raise your hand and come off mute, or type in the chat.
Hi, Nicole. This is Lindsay from Oakland County Health and Human Services.
Hey, Lindsay.
I'm curious so it sounds like, just to be clear, I'm getting this correct, that there was like essentially a stipend provided for people who went through all of these sessions.
Yes.
And I'm curious, did you have more interest than you were able to meet? Or like, how did you prioritize or limit the pool of potential applicants? Because I mean, I know it's work, but there was also a stipend, so I'm sure that makes some limit on it.
Yeah, no, that's a great question. So we actually kind of had like pseudo conversations with the organizations before they were full on onboarded. So we actually required them to complete an agreement before they participated. And so like we've done similar ones for our Health Equity Council, but it was really our opportunity to lock them in. The thing was, we didn't make this like a widely known thing. Like we were pretty intentional about the 12 organizations that we chose. I think we actually first identified 14, and there were 2 that just weren't interested just because of capacity issues, and we really missed out. But I think one thing that we've learned throughout the process is there was a big need to constantly be checking in with them, because the biggest thing we observed is there's a tendency to just have some like technology issues. That was probably the biggest thing we had to deal with, is maybe those grassroots organizations are led by individuals that are you know, of the senior population. And so we needed to kind of help them with some of the tech components. But yeah, I mean, we were kind of quiet about it, I guess, and reaching out to organizations in particular. And then we just endeavored to communicate with them constantly. Kind of at the midpoint, we would send out emails that are like, hey, everyone, these are the items you've completed. This is, you know, at this point, this is what you're eligible for. This is what you have to do still. And so I think we were able to contain it well, just because it wasn't widely advertised. I think had we made it widely advertised, it would have been very tricky. I will say not every organization got the full stipend amount. So there were some that got under because they didn't attend all the sessions or whatever the case may be. And so that was a little tedious to monitor, but we figured out a way to do it that was manageable.
Okay, I have a question. Sorry, not to let the Oakland team keep being the ones talking.
I love to hear from my friends in Oakland.
I know, this is such a cool idea. Did you, like, the content for, like, the grant writing workshop and the data workshop and whatever, did you kind of like contract that out? Did you do it
Yes.
in-house?
So we work really closely with a group here in Genesee County called the Power Initiative. It's a minority or owned company. They've been our partners in our Health Equity Council since the jump. We love them dearly. We promote them any chance we get. And they did a great job. They worked pretty closely with our council just in terms of like, okay, what are the topics that we should cover as part of this workshop? And then they would kind of outline and we would spend council time kind of going through like, okay, we're talking about budgets. What do we need to talk about specifically? And so they did a lot of the content work. And that was nice too, because I think one of the other things that I was always really careful of, and I like to be thoughtful of is, technically we're the organization that's funding these entities. So having like a partner that's leading the workshops and things like that makes you feel like you're a little bit more neutral in the space. And that was really helpful, I think, overall. But I adore that group. I'm happy to share their contact info. I know they were working primarily in Genesee County, and now they're starting to dabble in other spaces, but I adore them. So I'm happy to share their contact info if it's something you're interested in.
Awesome, thank you.
Yeah.
Oh, thank you so much for volunteering to go first, Nicole. Would the folks from Judson or the folks from Oakland like to go first or next? All right, well,
You can go next if you want.
thank
That'd be fine.
you, yeah.
That was awesome, Nicole. Thanks so much for sharing that. Let me just pull up.
Michelle, your mic is a little muffled.
Is that better?
It is.
Okay, I'm having microphone issues, so we got a big fancy one. Let's see if it
Alright.
works. Let me know if you can't hear me, because I'm really tired of these mic issues. Can you all see that screen okay?
Yes, we can.
All right, so the Judson Center is the backbone organization for the Macomb Health Equity Council. As a council over the summer, we did a series of visioning sessions. And so this is what we created for our mission statement, that our role is to coordinate activities that promote health equity throughout Macomb County. I forgot a word there, particularly in racial and ethnic communities for whom health disparities have been magnified by the COVID-19 pandemic. And our vision is for all Macomb County residents to have equitable access to health care. We also have value statements and impact statements, but in the interest of time, I won't share them all here, but happy to share those with others who are interested. Our highlights so far for this second year of the grant cycle is that we have 18 council members. We've added 2 new members from the Chaldean Community Foundation and the Midwest Buddhist Meditation Center. We've also just completed our surveys, which we had 715, I think was our final count. We also are doing 2 new community health worker cohorts that are being trained now. They will graduate in 2 weeks. So by that time, we will have trained over 50 community health workers with diverse racial and ethnic backgrounds who can connect directly with their own communities. I'm just going to give you a quick run through and then I have some more detailed things, but just so you kind of have a sense of what our big picture is. We didn't do mini grants per se, but we did co-sponsorships this year. So events that were happening, but we gave them additional funding to ensure that a community health worker could be present at that event and help connect people to services. We've done 10 of the, I think we're at more than 10. We had 10 budgeted for, but I think we were able to squeeze out a few more. And then additionally, we've been really focused on Medicaid redetermination, which I'll talk about in a moment. Lastly, we did recently create a communications toolkit so that everyone could have the same talking points and same guidelines around how to use social media and traditional media. And then we have also been disseminating COVID-19 information. So that's big picture. Wanted to highlight a few key things we've been working on. So one of the things we've been focused on this year is around sustainability. And as part of that, we have partnered with the health department to join the Healthy Macomb Advisory Committee. This is the group that oversees the county's health assessment as well as the community health improvement plan. We had 10 of our council members actually joined as members of the advisory committee. And they recently the health department recently came to our last meeting in January to present the CHIP findings and then invite additional participation in 3 of the work groups that they'll be hosting that will actually be implementing the changes. And those are related to the social determinants of health, specifically built environment, chronic disease and healthy lifestyle, and behavioral health and substance abuse. So that's been really exciting as an avenue to continue to really embed our work into local policy and infrastructure. Obviously, a big focus of our project is around building infrastructure for community health workers. As I said, we've just completed our 2 additional cohorts. So we have over 50 community health workers newly trained. We also have been partnering with the Practice Transformation Institute as the group that conducts those trainings, and they are working on developing a community health worker app. So for CHWs that are not necessarily working for one single health system, this is a way to maintain medical records. Information can be shared confidentially, of course, HIPAA compliant, of course, and the app is still in development, but it's being tested with community health workers now. So this could be a resource that we roll out over the coming months. The goal for this app is really to keep it cost efficient. Like, we want to make sure that community health workers can use this for a minimal cost per month, but have all their documentation in one place. We also are looking at how can we use this tool to connect community health workers. So share resources. For people who are one community health worker in an organization, how can they maintain that relationship with other CHWs and other groups? So we're exploring that in different ways, maybe through the app. But we also are doing community health worker listening sessions. So our first one kicks off on this coming Friday. We have 25 people who have registered. That's in person. And then we also have 2 virtual options happening next week, which I think we're somewhere around 20, 25 registered for that as well. So the goal is to ask community health workers, what is their experience in the field? We have already done the survey of 700 people, was directly to community members, asking them, what are your healthcare needs and what are the barriers? So this is that next layer of that research to understand from the community health workers' perspective, what do they see as barriers and challenges? What's going well with this work, and how can we better support them as organizations? So that information will be shared. Hold on, let me see. That information will be shared with our broader coalition as well as partners at a meeting that we're having in March. Also at the March meeting, we're continuing to do some asset mapping. So we're looking at, we kind of talk about our council as a spider web, where we are connecting with all these different groups and continuing to build out that network of support for people in the community. So we're hosting the partner meeting in March. And we also have been inviting partners to come to the council to share with their work. For example, we had the Safe and Healthy Macomb initiative come and teach us about the new resources that are being developed to address the opioid crisis. If you have not been looking at that in your own counties, I highly, highly recommend it. There's a lot of funding coming into the state, the county level, and the municipality level. And a lot of that work is cross-cutting around health equity. And that funding is at least for the next 18 years. So there's a lot of opportunity here to support behavioral health, and that's just a critical need right now. So pretty much every partner meeting we've had has emphasized that mental health is in a crisis level. So we're really excited to see how we can build up that type of partnership. All right, I'm almost done here. Just a few more things. So far in this grant cycle, we've been able to serve or educate over 800 people These are some of the events that we have co-sponsored. I won't go through all of them, but we really were looking for ways to connect with people in the spaces where they naturally congregate. So for example, we've sent community health workers to go to like 5K run and walk, celebrate, cultural festivals that have been happening. The Wave Project is a mobile showering unit that people who are experiencing homelessness can go and get resources, get a good shower, and walk away with a swag bag from us. And then we're continuing to do health fairs and Medicaid redetermination events. So just a quick note on the Medicaid redetermination. This has been a huge focus for us this year. We have been really encouraging our community health workers as they're going out into the field to ask people, is there information up to date for Medicaid? This renewal process is happening, I think, through May of this year, right? So it's critical that people are updating their information in My Bridges. We pulled this chart from the DHS website a couple of weeks ago, I think, at this point, and it was statewide numbers. But the thing that I just wanted to flag that we are concerned about at our county level is the orange graph all the way to the right, where it says 362,000 cases have been closed for 360,000 Medicaid recipients there have been closed for procedural reasons because they didn't respond to the letter. And there's so many reasons people could not have responded to the letter. We are curious about what those numbers look like in Macomb County. And certainly I'm sure y'all concerned in your own counties as well. But the more we can, train community health workers to maybe intervene at that point of closure, they do have that 90 days to re-enroll. So we want to make sure people are getting back on Medicaid if they're eligible. And like I said, we're just continuing to look for moving forward, opportunities for long-term partnership. We really want to embed this work into the policies and practices locally. And we think it's important that we are really partnering with groups that are not just traditionally viewed as healthcare, but who serve our target population. So we're continuing to do a lot of outreach and learn about lots of great different grassroots groups in the area. So I think that's all I have. Happy to take any questions.
Thanks so much, Michelle. It was great to hear about the work that you all are doing at Judson Center. I think y'all have a very cool mix of approaches there in terms of your community health workers, your Medicaid redetermination, and overall outreach that has really been evolving throughout the last, what is it now, like 17 months or so that we've been hanging out. And congratulations, Judson Center. I think it hits 100 years this year, so that's also a big accomplishment. So awesome work. Any immediate questions, first thoughts that come to mind for anyone that you want to ask in the larger group? All right, well, I see the team from Oakland turned on their videos, so I'm gonna go ahead and pass it over to y'all. Thanks so much, Carrie and Lindsay.
Hey, everybody, I am just sharing my screen. Trying to. Let me see. Okay, can you all see that?
Yes.
Yes, looks good.
Okay, perfect.
Okay.
Lindsay, you're gonna kick us off, right?
Yeah, perfect. All right, so hi everyone. I'm Lindsay Terhar. I work with our Oakland County Health Equity Council. Carrie and I work for Oakland County Health and Human Services, so we're the backbone organization there. So yeah, today we wanted to talk to you a little bit about kind of our process from start to finish, because we're finally seeing a lot of things come to fruition. And there have been, like I'm sure everyone's had, some lessons learned along the way. And our process has looked different than I think we originally intended for it to, but a lot of that was driven by our council members, and I think we definitely have a stronger final product because of that, which is great. So first I'll talk a little bit about our committee itself. These are our council members. So for our grant, we really wanted to focus on COVID-19 disparities in the Black, Hispanic, and Arab American communities in Oakland County. So we really prioritized seeking out organizations that serve these communities, and then also community members that are members of these communities. Trying to get a balance of some established partnerships. So a few of our council members, the health division has worked with quite a bit in the past. And then some of them are brand new organizations for us that we haven't worked with before. So we were excited for the chance to build some new partnerships with organizations, especially those that serve these specific communities in Oakland County. And then on this page here, you can see this is our vision statement that was created by our council. So our council has been they have really done a great job of being very intentional about the language that is used and crafting this vision statement, and also intentional about some of like our branding. So you can see we have our logo and branding in this PowerPoint as well. So these are all things that I think have taken a little more time than our group maybe thought they would, but I think that's been due to our council really having a strong role in shaping this and wanting to ensure that we do it right and we're set up for like long-term sustainability. And we've been really thankful for their input in that process. And then, yeah, I'm going to turn it over to you, Carrie, for this part.
Over the course of kind of our grant life cycle, we've been doing different types of data collection to help inform grant activities and a strategic plan that we're going to be putting together. So one of the first kind of projects we were working on with council members was to conduct focus groups. So we did do focus groups and collect data from BIPOC community. We had kind of three separate ones: BIPOC community, Spanish speaking community, and the Arabic community. We did recruitments heavily with our partners, a little bit through social media. And then we had interpreters present during the Spanish and Arabic focus groups. And some of these we're kind of simultaneously doing our community health assessment, which our team is responsible for too. And I know some other councils have referenced that. So some of these were done kind of in collaboration with our focus groups for our CHA, and just added some more like COVID specific questions on as well. So then kind of some top themes that came out of these focus groups. People talked about food a lot. This is also true for our CHA focus groups. There's a lot of emphasis just on continued rising food costs and food insecurity. And then also culturally appropriate foods is very important. People mentioned a lot of social isolation during COVID. especially for those who don't speak English very well. They found that whole period very isolating. I'm not going to read all of these. We've talked a lot, and this will be a recurring theme throughout our presentation about language barriers. People definitely experience that. And it was interesting, one other kind of thing I found interesting from the focus groups that maybe you wouldn't necessarily expect is that some people felt like they were better off during the pandemic. There were more benefits they felt financially more stable during the pandemic. And then some of the effects, since that's been rolled back, now find themselves potentially feeling less secure.
So in addition to our focus groups, we also worked with our partners on collecting data from their SDOH screeners and needs assessment processes. So one thing we really wanted to accomplish with this grant is to help get some data sharing across these platforms, because we know like many different partners are doing this work in many different capacities. And there isn't always a way to bring that information together to see what the cross system needs are, and also how needs may differ by population. And so obviously for this grant, we were specifically interested in looking at how trends differed across our priority populations. But we were also interested in overall trends in SDOH needs, specifically as they've been impacted by COVID. So this was an exciting opportunity for us to kind of be able to actually like provide some money to our partners to do this work of like culling this data and sharing this data, because it is a heavy lift. But we felt like it would really help paint a more comprehensive picture of need within the community. So here you can see some of our overall findings that came from this. We were able to collect data from all of our partner sites. We combined it with our own data from the screeners that we do at OCHD. And then our council came together and really examined all of this data over the course of a couple different meetings, and really kind of pared this down to create some meaningful analysis from it. But we really found that unstable income and employment, unsurprisingly, were really driving some of these more like downstream SDOH factors, specifically related to basic needs and care. Healthcare was a frequently cited need at sites where healthcare needs were assessed. Not all of our partners asks about it, but those that do, healthcare was frequently cited, often due to lack of insurance coverage and subsequent cost with lack of insurance coverage. We really saw housing, safe and affordable housing emerge as a common need across all of our sites. And then transportation, and again, like Carrie said, from our focus groups, we saw food access come up, but we really noticed a trend of like healthcare and housing just pretty consistently emerging across all sites as real needs that clients of these organizations are presenting, and not necessarily finding them being met within our current public health system in Oakland County. And then we also, like I said, looked at this by race and ethnicity, because again, we felt like this was an important opportunity to do that analysis. Almost all of our partners, I believe all of our partners, also collected race data, all collected data on Hispanic ethnicity. Unfortunately, only a few collected information on Arab American identity. This is a real data collection problem that we've known about for a while, but we were working with the data that we had available to us. But Hispanic identity and racial identity was captured by all sites, so we were able to compare across sites for those identities. And we did find that white clients were less likely to screen for a social determinant of health need than clients of other races. And also they, on average, screened for less total need than clients of other races. So I don't have the number off the top of my head, but I believe for white clients, it was like 2, in the range of 2 to 3. And for clients of other races, it was 4 and between 4 and 5. So we did notice a distinct difference there. We did notice that for Black and Hispanic clients, we were typically seeing the major needs we identified across sites. So we were seeing income and employment, housing and healthcare as the top needs. For our Arab American clients at the locations that indicated and collected that information, we did see a high need for utility assistance and household supplies and transportation. So those needs did differ slightly across different populations.
Okay, so I am going to talk a little bit about the strategic planning process that we've simultaneously been working on. As you can see, our team really likes data. We gathered a lot of data. And so everyone came together and did a lot of thoughtful brainstorming and wanted to identify some potential strategic priorities that we would focus on or come together around. So this full list was originally, they came up with like 6 topic areas. And then we wanted to get them to narrow it down a little bit, but they didn't feel comfortable doing that until they had a better understanding of what was already occurring among partners in the community and therefore identifying where some potential gaps may be. So we took some time kind of pulling all that information together, bringing it to the council. And then from there, they felt more informed to make some decisions and kind of also did a process to rank some things around like feasibility and some other factors. There was a lengthy discussion about how we constantly talk about transportation. I mean, I know it's an issue in the state. It's a particular issue also in Oakland County, but I've been working for the county for 10 years. We haven't made a ton of movement. We have partners who feel very similar. So that was some of the logic behind picking some of these things too. So we really honed in on access to healthy foods and access to mental and behavioral health. And these issues of language barriers were kind of common across all of these areas. So you can see we put together, we have some goal statements of where we want, what we want to get to, and we're incorporating those language barriers into both of these. So, moving forward, we're going to be really focusing around mental and behavioral health, and specifically how there are gaps for people that speak languages other than English, and specifically also focusing on mental health inequities among people of color, and then also focusing on access to healthy foods, and again, just mentioning that rising food costs and food insecurity, and having access to culturally appropriate foods and food access in where communities of color are. I felt like I was going to say, so I feel like these we're kind of in, you know, we've been working on our community health assessment process too. So we are seeing some potential similar areas come up there. So as we move forward, we want to we will be making sure we're kind of, you know, aligning these different initiatives for sustainability. We also, like other organizations or other jurisdictions, have been working on opioid projects, and especially we will be coming up with the spending plan for opioid settlement dollars, and have been doing community listening sessions around those too. So feel like this goal of the mental and behavioral health could definitely have some overlap there as well. So, all right. And Lindsay will talk about our mini grants.
Yeah. And before I jump into that, I'll just kind of build off what Carrie was saying to say that I think this council has really kind of crafted a space for themselves in our other work that's happening at the health division by really taking this specific lens of like cultural acceptability and language acceptability and barriers, and like applying that. And being able to bring that lens to these other projects, I think will be really worthwhile and help set us up for some sustainability with this group and ongoing work beyond just this grant funded period. But mini grants I can talk about now. So with the extension, we decided we also wanted to get some funds into the community to support organizations that are doing work related to COVID and SDOH. We worked with one of our council organizations, Pontiac Community Foundation. So they are not a direct service provider, but they do a lot of foundational work within Oakland County, beyond just Pontiac, but started in Pontiac. And this was working through them was a workaround for us because the county has, and I'm sure some of you who work at county government understand this, very stringent guidelines and a really in-depth process on awarding like subcontracts. And so this was a way that we felt we could, in a more streamlined way, ensure that we're getting this funding to more grassroots level organizations and not limiting it to larger organizations that meet, like, for example, the county's insurance requirements, which are quite hefty. So we worked with Pontiac Community Foundation, who has done this work before. They helped roll this out for us. So we put out an RFP for these mini grants. We broadened the categories for the mini grants to the 6 focus areas that had originally emerged from our data collection. So we didn't limit it to just the mental and behavioral health and food. We kind of pulled in all of those: transportation, food, housing, healthcare access, all those pieces that we had identified from the SDOH data and the focus groups, and that the council had deemed as important. We did receive 21 applications that are in review process now. So we're happy to see that. Several of our applications are from organizations that we have never funded or worked with before, which is great. Pontiac Community Foundation and our council did a really good job of pushing out this opportunity. So I think that really helped it have a further reach than we would typically have just using the county's resources. And so we will select 10 awards from those 21 applicants to receive funding. And we are using a fully independent review process. Besides, we have one of our community members will be sitting on the review team, as we didn't want to limit our council members from applying, but we still wanted to have like a fairly unbiased, as much as possible, review process. So I think that's all we
I
have.
think
right,
that's
Carrie?
it.
Yeah.
I think some of the next steps we have planned, moving forward, obviously, finishing out these mini grants, but then also our council will be helping be another avenue to help kind of inform our child process and developing our community health improvement plan. And then also we have some other grant projects in the health division that have been working on things like a vaccine equity plan. And so we're grateful to have this council who has this very specific lens be able to inform our other work that we're doing that's not necessarily limited this funding opportunity.
Thanks so much, Lindsay and Carrie, for sharing. It was wonderful to hear a bit about the work that y'all are doing over in Oakland County. Lots of kind of positive pieces shared, and I hope that your grant review process goes pretty smoothly, and I can't wait to see more about those projects. I am going to go back to sharing my screen really quickly to get us ready for the next part here. So we're just gonna do some breakout groups. I know not everyone loves breakout groups, but it tends to get us a little more conversational, a chance for folks to maybe ask questions that they didn't want to ask in the larger group. So we're just going to do 15 minutes in kind of smaller breakout groups, each kind of centered around the presentations from our teams that we saw today. So Macomb, Genesee, and Oakland. And so feel free to ask them any additional questions that you may have about how they were able to do their work, any challenges that they were able to overcome and allowed them to be really successful in the place they are today. Or if y'all are doing similar work, that is another chance to create some connections and do some sharing and possible collaboration going forward. So just as a brief kind of highlight of what was shared today, Macomb shared a bit about the work that they've done with their community health workers, their Medicaid redetermination, as well as their community event sponsorships centered around health education, dissemination, and overall outreach. A Greater Flint Health Coalition shared a bit around their mini grant workshops and how they went through a very collaborative process to execute those. And then lastly, Oakland County talked a bit about both their SDOH data collection and their mini grant process. If that's not enough to talk about, some additional things to consider is just, as we start to look forward, thinking about sustainability. What is your backbone organization currently doing to plan for sustainability and thinking long term? What do you see your organization continuing in
going bad?
Is someone not muted at the moment?
That might have been me. I apologize.
It's all right. Thinking long term, do you see your organization continuing in a backbone role? If not, how do you see your council continuing, if at all? And if yes, how will you all continue to show up as a backbone? So Lindsay just opened the rooms. So if you look at the bottom, let me stop my share. If you go and look at the bottom of your screen, that banner where you can mute, turn your video on and off, there should be 3 dots that will allow you to select breakout room. And then from there, you can pick whichever room you would like to start in. You can hop around and we'll just do that for about 15 minutes. Yes, I can share those questions again. And I can also put them in the chat too. So there's lots of different things that you all can talk about sustainability, kind of centered around these questions here, or just asking additional questions around the work that each of the teams that presented today have done so far. If you are having difficulties joining a breakout room, raise your hand, use the raise hand function, or just come off mute and we'll help you out.
Our facilitators all made it into their rooms.
I believe so.
Yep.
Yeah. For anyone on the team, if you are interested in kind of hearing more discussion, interacting more with backbone organizations, I think this is a really great opportunity to do that. I really encourage folks to create more relationships and more community throughout this work. And yeah, I'm just gonna go off camera for a short, but that is my word of wisdom to you all. Leslie, Heather, is there a room that you are interested in being in that we can help you find?
I have both Olivia and Brian on the call, and realistically, I'm so unhelpful on the programmatic side. I was just going to
That's
kind
all
of
right.
wait it out.
Okay.
But I
That's
can go into a room if you'd prefer me to do that.
No, it's all good. I just wanted to help.
I appreciate that.
Yeah.
Hi, everybody. Last time, if you weren't on this meeting, I got to introduce myself without giving you any homework. Unfortunately, today I will be giving you homework, but I don't think either ask is going to take too much of your time this month. The first thing I want to talk to you about is success stories. So success stories are a particular way of sharing the successes we've had in our project. There's something that the CDC likes to do across all of their different strategy areas. You can think of a success story as like your chapter in, if we were writing a book that was going to tell the story of this grant, your success story would be one chapter of that book. So in these stories, you don't need to be thinking about everything you've done over the last year or two related to this work. You just want to pick out one story. So think of a watermelon seed, not a watermelon. You're gonna really focus on like one activity, one accomplishment. They're also not based on formal evaluation or measurements of success, so that they're different than any other evaluation activities we've done for this grant so far. They're really based on what you think was successful about the work you've done. What changed because of the work you've done? How did the work you did make a positive difference in people's lives? And then the way that we eventually can use these stories, once we collect them, is to help share the impact of the work with peers, partners, and decision makers, aka the people who can give us money. So they tend to be more persuasive in nature because they're based on what you thought was successful. And they tell a story of the work that was done instead of just kind of being some random numbers that the CDC thought was important. So I really like writing these, and I think they're a much more accessible evaluation activity. Our goal with them for this grant is to collect at least one from each of you. But if you have more than one story, you'll be able to share that. I'm going to share the details on how the process of how we're going to collect them. But first, I just want to tell you a little more about what makes a good success story. If you could go to the next slide. So what makes a good success story is kind of the same things that make any good story. So there's going to be a beginning to the story, a middle, and an end. And we're going to be collecting the beginning, middle, and end of your story from you via a REDCap form survey link. And the survey is broken into 3 big questions: the beginning, the middle, and the end of your story. A lot of what you guys presented earlier today, a lot of those like individual activities would make a great success story. So every success story starts with a challenge that you saw in your community. So answering questions like, why was the work needed? What was the problem? Who identified the need or problem? How did you know it was a problem? And where or when? So for example, another CDC project that I've worked on had the really big goal of reducing cancer disparities for the American Indian and Alaskan Native population. And it was a 5-year grant. So obviously we did a ton of stuff over 5 years towards that really big goal. But when we're talking about a success story, remember, we're narrowing in on the watermelon seed. So for this example story, the beginning was that one of the partners we worked with noticed that there was a lack of CDC materials that shared information about cancer in a way that the American Indian and Alaskan Native population could understand or felt engaged by. And they especially noticed that there were no CDC language translations written in AIAN languages. So there might have been Spanish or Arabic, but there weren't the languages that their population who experienced health disparities needed. So they noticed that. That's the beginning. So then the middle of a story is about the solution that you came up with. So what did you do? How did you do it? And who else was needed to complete the work? So in this example, they decided to take some of the CDC's official cancer prevention resources and materials and translate them into an American Indian language that was spoken in their community. So they had to identify the CDC tool they wanted to translate. They had to find a translator to work with to translate them, the materials, and that was the middle of the story, their solution. Then the end of the story is the impact ultimately that the work you have completed has on your community on addressing that challenge that you identified in the beginning. So what was the impact of your work? Who will continue to be impacted or involved in the future? And then how was this funding or the technical assistance you received important to making that work successful? So in this case, the end impact was that they had new health information materials that were translated into a language that was more engaging to the community they were trying to reach. And they saw an increase in interest and engagement from the population they were trying to reach based on that they had translated these resources. So I hope that gives you a little more information about what we're kind of looking for or what you should be thinking about when you're thinking about which activities might make a good success story. If you could go to the next slide. The last component that can make a success story really powerful is if you have evidence to support that impact that ended your story. So examples of evidence are quotes from a partner or participant, pictures, sample materials, like if you made a flyer for an event, videos, or if your activity or event made the news, if there was a news story. So you'll also be able to have the option to submit or upload these evidence pieces with your success story. It's not required. It's just something that kind of is a cherry on top that can really make your success story look really good and help people understand the work that you did. So like evidence for this example success story is that we had pictures of the translations. So we had the translated flyer and we included that with our success story submission. If you could go to the next slide, I'll talk through how we're going to collect them. So that's what a success story is. I hope that it made sense, but if you're still feeling confused, that's okay. It's going to be our job, the evaluation team, to write the success stories into that format and make sure that they fit the CDC's requirements. Your job, what you need to focus on, is submitting a form we prepared via RadCap survey link. You don't need to use complete sentences or answer every question and every prompt. They're just there to help you think through that beginning, middle, end, like I talked about. We're just going to take whatever you provide and format it into the correct format. So don't get caught up on making sure everything is formatted perfectly. That survey link is set up so that you can go and view it or even get started on it and then save and return to your responses and keep filling it out until you're ready to submit. Alternatively, you could write your responses in a separate document like Word or something and then copy and paste them into the form once you're ready to submit it. Also, if you are having trouble with the form, and especially with uploading your evidence, you can just email it to me directly and I'll make sure it's included with your form. When you complete the form, you'll also have the option to send yourself a copy of your answers and a confirmation that you completed the form. If you forget to do that and you want your responses later, you can email me and I will send them to you. We would really like if we could collect responses from everyone by Thursday, February 29th. We'll start working with them as we receive them. But this February 29th deadline will give us time to do follow-up for if there's extra details we need to get from you to make sure that everything we're putting in the success story is accurate. And again, if you want to submit multiple, you can, but you don't need to. If you wanted to submit more than one, you could just go to that survey link multiple times and submit multiple stories. And my email is on there for if you have questions later. I'm also going to put my phone number in the chat in case you want to call me.
Thanks.
Any initial questions? Okay, you have my number and my email if you have questions later. And also there's office hours later this month. So the second thing I am asking of you is to help us with updating our eco maps. You might remember these from last year, almost about exactly a year ago. Eco maps are an evaluation tool we have for measuring our partnerships. So obviously, in the type of work you all have been doing, partnerships and relationship building are really important, but they tend to be things that are kind of hard to measure and evaluate. So eco maps help us measure the partnerships and see connections, look for where there's gaps, strengths and weaknesses. And that can be really helpful for guiding our work forward. For example, in last year's eco maps, one thing that we noticed once we had all of your eco maps and could look at them all together was something really unique and cool about this work is how many sectors you all are connecting with. So a lot of times when we do eco maps, we tend to see like one sector, for example, healthcare dominating our partnerships, and then there's gaps, like we need to get other sectors involved, like maybe grassroots organizations or food banks, whatever it is. It depends what you're working on. So one thing that we were able to take away from when we did this last year was that that's not as much of a problem for you all. You all are establishing partnerships across lots of sectors, which is awesome to see. But now that the data we made those eco maps off of is a year old, we're going to do the process of updating them. So if you go to the next slide, I'll tell you how we're going to do that. So this is going to be easier this year than last year because you all already started the work. We already collected this data once. So how it's going to work is I'm going to send you the template you completed last year. So you won't be, this is a picture of the blank template, but your template won't be blank. You'll have past you to thank. Past you already got started on this. And all you're going to have to do is review it and update it. So if you've made new partnerships that aren't on that sheet, you can add them. If there's people on there you're not partners with anymore, you can like strike through to cross them out or just delete them. And this will allow us to update the eco maps. One thing that would be very helpful for you to do when you're updating these templates is to use an organization name for the name of the partner whenever possible. It can be hard for us to figure out what organization an individual person is associated with because you're working with them, we're not working with them. So we just don't always know, like not everyone is available online. So we try to Google and look stuff up, but it does make it a lot easier for us if you just give us the organization name instead of the individual's name. And then also spelling out any acronyms for an organization. Again, we try to Google and decode what acronyms are, but sometimes there's like multiple organizations in Michigan that use the same acronym. And so it can be hard for us to figure out what you meant when you use an acronym. So when you're updating this, if you could remember to just spell out the full organization name, that will be helpful to us and minimize the amount of follow-up questions we have for you. And also minimize the amount of us just getting things wrong. For example, there's two really big organizations that both go by the name Access in Michigan. And we don't necessarily have a way of telling which Access you're talking about. So like if you were working with Access over on the east side of the state, and you could spell out like Arab American community, like whatever it is, like that's very helpful to us. We're also hoping to get these updated templates from you all by Thursday, February 29th. So you have one due date to remember for both of these evaluation activities we're asking of you. And I will be sending you your templates from last year after this meeting today so that you can get started. Any questions about the eco maps?
Awesome. I just want to say thank you, Carlin, for going over both the eco maps and the success stories. So while these are, required activities for you all, there are ways that you can utilize these as future supports for your council. So thinking about those success stories as kind of nuggets that you can share with future funders, potential partners, or as ways to create more energy around your work that you're doing. It's always nice to have those positive reflections that you can look back at and share. And then thinking about your eco maps as a tool for identifying additional partners as you all grow and expand, or as you revisit your action plans or plan out future work, you can look at who's at the table, who have you already been able to connect with, and how maybe they can be a part of those specific objectives and strategies that you have laid out for going forward. So while these are things that we're asking of you, they can also be tools and assets to you all as you go forward. So there's that. And then we do have office hours on the 21st of February at 3 o'clock on Zoom. You'll get a reminder email, and that will be a wonderful touch point if you have specific questions about completing your eco map, writing up a success story, or if you just want to share some of your ideas and work through filling out that form. Carlin will be there so that we can spend some of that time with that, as well as a couple other things that will always have a little presentation that we can share with you all. So that's what I have to add. Any other questions that folks have? Awesome. So we have a couple grant updates. Afton, where are you?
I'm here.
Okay. Well, I'm gonna let Afton go through some of the updates. I added a slide. I'll go after you, Afton.
Alrighty. Good afternoon, everybody. Of course, we love being in this space with you all. I'm going to be really short, sweet, and simple in the interest of time. Again, we do have office hours, so if there's questions about things, we can discuss them there. Also, we can connect with you all. We will probably connect with quite a few of you individually anyway about what we're about to just talk about. So, next slide, please. All right. So I think we shared with you last time we were applying for an additional no cost extension. We did receive said extension. We just found out last week. So this is hot off the press. And so we do have an extension that will run through September 30 of 2025. That is not a mistake. September 30. Through 2025. So we are very excited. Again, no cost means they did not give us more money, but we did get more time. So we want to make sure you all are aware of that. So I know some of you were already thinking about winding down some efforts because we're expecting that we were going to end around May. Time is absolutely money, Carlin. So we definitely want to let you know that we will be extending these efforts. That does mean that there'll be some additional contractual things that will need to happen for you all, as your contracts right now will end in May. So you know that we'll be in touch about what that's going to look like contractually. Obviously, there'll be some budget things that will need to happen. And so you can expect to meet with us and hear about what's happening there. I think, but I can't remember. I know we told you that we were literally going door to door with the collection plate, asking folks to give us dollars. So we do have some support coming from our PHA, which is our Public Health Administration Department here at MDHHS, in the term of the infrastructure grant. Through this grant opportunity with our other team members, we do have some support for our epidemiologist coordinator. We also have some support for our health equity coordinator, which is Danielle, if you didn't know. So we're happy to have some support for Danielle. And we're also going to have a little bit of support for the councils that will come from this grant. We will give you more details about what those dollars look like as we get ready to do that contractual piece. I can guarantee you we do not have the kind of money that we had when we first got our councils up and running. So you can't expect that But we do have some funds that will assist you. So we are happy about that. We also got some funding to work on a new version of a statewide health equity roadmap. The previous iteration was done back in 2012. As you all know, life has changed a lot since 2012. And so we will probably want to connect with you all around what we're going to be doing with that roadmap work. So more to come on that piece. We also was able to secure some financial support from our friends over in cardiovascular health. They will be working with a few of the councils. And so those of you that will be working with cardiovascular, you have already had some conversations with us in that team. They are looking at doing some work around cardiovascular health, looking at particular minority populations, and also looking at the impact of racism on cardiovascular health. We are really excited about this project. And so they've already, again, reached out. We've met with Detroit, city of Detroit, which is Moses, Saginaw, Muskegon, about this opportunity. The Genesee Regional Health Equity Council in Flint will also be a part of this project, although it's under the 2305 version of this grant, and the one that we'll be doing the other work for is under 2304. We definitely have a few other things up our sleeve. I feel like I just said earlier to Jasmine, I feel like the last 8 months of my life has been about money, trying to convince people to give us some, but we are excited that things are going well in that direction. So I do have at least 2 other things up my sleeve, perpetual sleeve, I guess, as we move forward in terms of dollars and support for these efforts. And so I want you all to know that we are continuing, as we promised you, we are continuing to find support to keep this effort going outside of just our original grant. And so we will continue to have more for you as we keep going in terms of partnerships and other entities that want to support our work. We've definitely been meeting with a few private foundations, as well as some of our friends in another one of our state departments that seem to be interested also in supporting this work. So as long as you all want to keep working, we're going to keep trying to figure out how we make it happen on the back end. So again, just wanted to share just some high level, this is where we are. We do know that we will be doing this work through September of 2025. I'm pretty confident most of you did not come to this call today expecting to hear that. So I hope that that's good news for you all and your teams. We will be doing another in-person convening. We had an in-person convening with you all in August. Everybody enjoyed actually being in the same space together. And so we will be sort of sharing a planning tool with you all to give us some feedback on what you want us to include in the in-person convening that we will have for you all in May. And then I don't know if Danielle wants me to say this, but I'm gonna say this anyway. We definitely visited some of you for our site visit when CDC was in town on our world tour of Michigan. And so I don't know if Danielle wanted me to tell you, but I'm going to tell you anyway. We have intention of visiting everyone else that we did not get a chance to visit in person during the CDC site visit for a site visit, to see you all, to find out more about what you're doing. And be able to sort of, again, share out what is happening at the ground level across this grant. So those are my updates for you. And I will pause and see if you have questions, issues, comments, concerns, or feedback.
I just want to say thank you for all the great work you guys are doing. This is Jason Blank. Sorry.
Thanks, Jason.
Thank you, Jason. I was expecting Brian to say something, because I know Brian knows I've been hustling out here trying to convince people to give us funds.
Well, what I can say is, thank you all for being so fabulous. The only reason that we get to have these extensions is because of the work that you all do with your partners and with your council, and creating such amazing stories for us to be able to share. with the CDC, to share with other departments, everyone that we go to. We talk about how unique and amazing this project is and how special the work that you all do is for your communities and how important it is. So, you know, I hope that having such a significant extension really generates some positive energy for you all. I'm going to say this now because I know that some folks are still contracting out their mini grants. Please do not extend the contract dates on any of those mini grants past your current contract date until we amend your current contract with MPHI. Please don't amend any of the smaller agreements. Otherwise, I will not be able to approve anything. So that is just something to say, but that doesn't mean that, you know, the work won't keep going. I just want to, you know, make sure that we stay checking the boxes that we need to. So you know, thank you all. And I put in the chat that we'll send out a survey for planning our in-person meeting with our follow-up email as well. And then in terms of what continuation looks like, we'll send out an overall email and, you know, set up meetings as needed to really follow up and go through that. But if you have other questions, feel free to come off mute or drop them in the chat.
I have a question. If we do successfully spend all of our dollars by the end of May, will we need to modify our contract or will we continue to report, or how will that work?
Are you quitting?
Well, no, I just know that we're going to be transitioning over to the cardiovascular health stuff, so the timing kind of works out.
Yeah.
So I'm thinking about planning for that and what that means, because
pretty much everyone's contract will need to be amended in terms of, at the very least, the date.
Gotcha. Okay.
So we'll for sure be working through that process, and it'll be similar to what we've done in the past around amending contracts to the end of this fiscal year, doing a whole new set of contracts in October. So that's just something to keep in mind in terms of we'll keep doing the same thing that we've always done because it's not broken yet. So let's keep going with the system.
Gotcha.
In some ways.
Yeah, so you're still going to have 2 contracts because you're going to need to, because our current contract goes through the original grant period, right, which is May. So we'll do through the end of the fiscal, and then you'll have a second contract, which will be a whole full fiscal year now, which will go October to September, which is something we have wanted to do, but we didn't have the resources to be able to do in the past. All right, so we got a question about when can we expect details on contracts? Very, 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 very soon is the answer to that. We got a few things we have to clean up on the back end real quickly, and then because again, this is hot off the press. We legitimately just found this out last week. So we have not had time to do the checks of the boxes we need to do on the back end in order to move forward. We're going to try to get that cleaned up as quickly as possible so we can move forward and get you what you need. But we want to get that done as efficiently as we can. But I didn't want to hold this and wait to tell you all. We wanted to tell you right now because we know that planning is important. And so, you know, knowing that we're going to have quite a bit more time than we thought, I think is pressing. And we wanted to make sure you all were aware of that. So good question, Chuck. And also thank you all for thanking us, but we really thank you for the work that you do, and we really love this work, and we want to do everything we can to keep it going.
This is Jason. I sent a message to Danielle, but I know she's facilitating at the Social Determinants of Health Conference. Excuse me, I'm sorry, everyone. Lieutenant Governor Gilchrist mentioned that there is a social determinants of hubs are, I guess, coming down the pipeline. Is that something you all are able to share, or is that just something that needs to come from the governor's office once things are kind of more fleshed out. I don't know if you all have any insight, but just
Oh
a thought.
yeah, we've got plenty of insight. That's a really good point, Jason. I'm glad you brought that up. We can share some information. Those are actually live at this point, and so we can share some information. That is a project that's being funded from Policy and Planning Division, and so we can definitely share with you some information about that. But they are actually live. And there will probably be some, I'm saying probably because we haven't figured it out yet exactly what it looks like, but there'll be some collaboration between our councils and those SDOH hubs. But we are still figuring out what that actually is going to look like in the long term. But we are working with their team on that project. So yes and yes.
Okay. Thank you. I received an email asking if I wanted to kind of like, I guess, support the effort, but I didn't know how to respond. So I'm just going to wait until you all say, hey, do A, B, and C when it has to do with the health equity stuff. And then just kind of go from there. Because I kind of was a little lost when I saw the email that came down and I was like, I don't know what to say. So I just kind of just said sure and then just left it at that. So so I just didn't know how to really truly understand it because Lieutenant, always Governor, but Lieutenant Gilchrist didn't really go into a lot of detail. He just mentioned it, and then that was pretty much it. So
yeah, that effort just got off the ground, but again, we have been in the background on that effort. So we will definitely be looking for some opportunities to connect both projects and leverage what we can to make sure that they're sustainable. Just seen another question about will we remain COVID-19 focused. So the answer to that is yes and no. We definitely know that our original funding, the OT 21-2103, is COVID related. But we also know that we've really talked a lot about that it is those drivers, it is those social determinants that, sort of were featured, if you will, by COVID. And so, yes, it will still have a focus of COVID in terms of thinking about those drivers and those social supports. However, as we bring in additional dollars for other parts or other project partners, focuses may be different. So for example, the cardiovascular health, that is literally looking at cardiovascular issues and concerns and really some different things that impact cardiovascular health in particular communities. What is happening with the infrastructure grant dollars, those dollars are really focused on expanding capacity. And so it won't necessarily be all focused on COVID, but obviously COVID is still going to be a driver. So as we get additional funds from other teams and we sign on for other projects, there will always be a little bit of a difference in sort of what the focus looks like. But realistically, moving forward, in order to keep our project going, we're not likely to be able to get too many opportunities that are going to blanketly just cover, councils. And so there will be some particular things that we'll need to be mindful of, in terms of what that funding stream will ask us to do. More will come as we sort of keep developing down this line, but we will need to have some things that are related to COVID itself, but more of it will be about those factors, so underlying issues. I just seen another question. Oh, never mind. We don't need that one. Okay, so yeah, we'll still be moving along the same lines of what we had before, but most of you all are doing things that are priorities for your community that are not always just COVID, but a little bit more upstream at this point. Any other questions? And then if not, Danielle, I will turn it back over to you.
As more and more questions come to mind for you all, always feel free to email me. I can drop my email in the chat, but I am very confident you all have it. And we can kind of troubleshoot and answer questions as they come up. I just want to share one quick opportunity with you all that came across my desk today, and it is a learning community that's been developed through what is called the Stretch Initiative. So this is focusing on establishing strategies to repair equity and transform community health. So it's another project very similar to the work that you all are doing with your councils, really focused on how can we address equity issues in the community and create systemic and infrastructure level change throughout spaces to ensure community engagement. And so they're having one of their first quarterly convenings, and it's open to everyone, whether or not you're a part of their stretch cohort. And so that will be conveniently right after office hours. So if you are interested in attending that, it will be on Wednesday, February 21st from 4 to 5 p.m. And there is the registration link. I'll also drop it in the chat, and it'll be included in your follow-up email as well. But that was just kind of the last thing that we wanted to share, and we may wrap up on time this time, y'all. This is crazy. Never happens. So I think we've answered many of your questions, but if you have more, I can stay on for a little bit longer
Yeah,
to
I
try and
can
answer
stay
some
too
of those.
if anybody has any other questions. I can stay for a bit too.
All right.
If not, thank you all and have a wonderful rest of the day.
Thank you.